SKaffold Training. This video will aid your understanding on what SKaffold is, how it works, and for the cases in which it is used. SKaffold is both a bone void filler and autograft extender. Hence, it has two FDA indications through 510K number K100986. The first indication, and most common amongst like products, is bone void filler. Bone void filler is to fill bony gaps or voids in the skeletal system. An example, extremities, spine, pelvis. These are not intrinsic to the stability of the bony structure. These defects may be surgically created osseous defects or osseous defects created from traumatic injury to the bone. The second indication is autograft extender. SKaffold is the only alpha TCP on the market with this indication, making it quite unique. The use of this indication is only for the pelvis and extremities. This particular slide shows bone graft and graft substitutes. SKaffold is a mineral or ceramic-based bone graft substitute. The category of bone graft substitutes is comprised of calcium-based products. A few of these products include calcium phosphate, calcium sulfate, bioglass, and several others. In this slide, we see several types of mineral or ceramic-based bone graft substitutes. SKaffold is a calcium phosphate cement, otherwise known as an alpha TCP that converts to hydroxyapatite. These type of materials behave like the mineral phase of bone. One of the calcium phosphate bone graft substitutes is alpha TCP. There are several different types of alpha-based calcium phosphates that set in vivo chemically convert, resulting in a porous hydroxyapatite matrix. These types of matrices are similar to mineral phase of bone without organic material like proteins, collagens, etc. The advantages of these materials are chemically, they are similar to native bone. Structurally, they are similar or greater in strength than that of native bone. Some are drillable. They all remodel naturally. There is no strength deficit during healing, typically. They are excellent for augmentation of hardware. They provide immediate and long-term mechanical strength. And by themselves, they are osteoconductive. The disadvantages of this class of materials is they can be finicky, both temperature and time sensitive. They need to be mixed and have different mixing systems. And remodeling can be slow, but is still at the similar rate of bone, being that of about 3 to 10 years on average. When discussing SKaffold, it has two indications. The following information is in reference to the first indication, which is bone void filler. Looking at the skeleton on the right-hand side of your picture, you'll see that this product is indicated for bony gaps or voids in the skeletal system in the extremities, which would be the arms and the legs, the spine, and also the pelvis. And these can be created by the surgeon in reduction of a fracture, or they can be created by trauma. As a disclaimer, that SKaffold is not indicated for vertebroplasty or kyphoplasty procedures in the spine. As you learned in Osteobiologics 101, every product has an algorithm. SKaffold's algorithm looks like this. Biologically, by itself, it is only osteoconductive. Structurally, it is at the higher end of the spectrum, at 50 megapascals, once cured. Chemically, it is like bone, because it will chemically convert from alpha TCP in vivo to HA in vivo within 24 hours. The handling of SKaffold comes in injectable and in putty forms. Average remodeling time, and SKaffold does remodel, is 3 to 10 years. Other properties important to know about SKaffold are that it is isothermic, meaning it remains at a constant temperature. It does not exude heat, unlike that of other products in the cement category. There is no temperature change with SKaffold. The porosity of the product is 40% nanoporous, meaning 40% of the volume of a mass of the product is air. This is a hard-setting product that cures anywhere between 24 and 72 hours at body temperature. Also, there is no adhesive properties with SKaffold, although it will interdigitate well within native bone. When further breaking down the algorithm of SKaffold, we see structurally it has high compressive strength, upwards of 50 megapascals. Compressive strength is the measure or the capacity of a material to withstand axially directed forces. When the limit of compressive strength is reached, the materials are crushed. Hence, SKaffold would be crushed around 50 megapascals. Therefore, this product at a minimum is about 2.5 times as strong as cancellous bone once it is cured. On this slide, SKaffold is at the lower end of bone, around 5 to 6 megapascals. Tensile strength is the opposite of compressive strength. It is the resistance of a material to a force until it tears apart. measured as the maximum tension the material can withstand without tearing or fracturing. In many circumstances, because the tensile strength is weaker, it may be necessary for hardware to account for this tensile weakness. Alpha TCPs, otherwise known as alpha tricalcium phosphates, convert into hydroxyapatite, which is similar to the mineral phase of bone. Therefore, SKaffold is like bone. SKaffold is a product that will remodel. As mentioned, it is similar to bone. It has a low crystalline hydroxyapatite structure that remodels under loading in a process that appears to be controlled by Wolff's Law. Alpha tricalcium phosphate cements are replaced by active cell-mediated bone remodeling and do not dissolve in vivo due to their chemical and crystallinographic likeness to native bone mineral. This image shows a highly magnified topical picture of the crystalline structure that SKaffold exhibits once cured. An important part of every algorithm is its timing. This particular product, SKaffold, remodels and does not resorb. It's responsible, as mentioned, to a native cellular activity. It is stress dependent. The more load, the faster it remodels, and it will be replaced by bone as bone replaces itself. Breaking down cell-mediated remodeling a little bit further, you'll see that the process includes osteoclastic resorption, so osteoclasts attach and excavate small pits within the bone. Then cross-linked end telepeptides are released. This catalyzes osteoblasts to attach to host bone, and thus new bone is formed. To further illustrate the remodeling capabilities of SKaffold, a study using a canine model was conducted. Each canine received a wedge osteotomy of the tibia. That wedge was filled with SKaffold material. Over time, you can see that via Wolff's Law, the material remodels into natural host bone. Furthermore, the images at 32 weeks and 78 weeks, you can see a great deal of remodeling has occurred, so much as maybe 50% at the 72-week point, therefore proving the remodeling capabilities of SKaffold. In your picture on the top left-hand side, you see a comparison between graph A and graph B. This is X-ray diffraction testing. As you can see, they are very similar to each other. A happens to be bone, B happens to be SKaffold material. The two images at the bottom show the osteointegration of new bone within the cement-like structure of SKaffold. We can see Haversian canals have been formed, and new bone is growing throughout the material, and load remains constant without any intrinsic gaps between new bone and SKaffold material. At the top right, we see a scanning electron microscope, otherwise known as SEM, image of an osteoclast burrowing its way and excavating pits throughout the hydroxyapatite material left by SKaffold implant. Let's learn now how SKaffold works. First, SKaffold comes in two delivery options. The first and most commonly used version of SKaffold is SKaffold Flow, an injectable paste. It comes in 3cc, 5cc, and 10cc sizes. Each kit contains pre-measured powder and liquid vials, custom rotary mixer with plunger, 10 milliliter syringe, 11 gauge delivery cannula. The other, and also very successfully used option of SKaffold, is SKaffold Impress, a moldable putty. This comes in 5cc, 10cc, and 25cc sizes. The 25cc size is unique as it's probably the largest volume of calcium phosphate on the market. Each kit contains pre-measured powder and liquid vials, mixing bowl and pestle, plastic curved spatula. A key differentiator of SKaffold compared to its competition is that it can be drilled. It is a key advantage and is drillable in only just 6 to 10 minutes. Once set, all manipulations of SKaffold need to be with tools that remove material as they advance. These types of materials are fluted drill bits, burrs, sharp reamers, etc. If reaming or burring, it may be beneficial to wait an additional 5 minutes or more to let the material continue to set harder. Proper technique is critical. Let instruments do their job, no pushing or forcing. While SKaffold can be drilled, SKaffold can be failed. Like any hard-setting dynamic product, it can be failed if not used correctly. SKaffold is not much different mechanically than that of concrete that would be poured in the real world. So use common sense. To break up concrete, people use jackhammers. A jackhammer is equivalent to a K-wire or Steinman pin in the operating room. A sledgehammer or blunt instrument is similar to the surgeon's finger testing the material too much, or a blunt instrument like a freer or mallet. It is always important that you and your surgeon use common sense within the operating suite. These tips will aid you in having successful outcomes with your surgeons when utilizing SKaffold. It is critical to make sure the vial of liquid's temperature is below 70 degrees Fahrenheit before using. If you're in doubt, always chill the box of product in a nearby refrigerator or freezer. Always have heated saline brought on the table just before using the product. Follow timing charts closely. They're there to aid in your success with the product. Cover with heated saline immediately upon finishing manipulation time. This is critical for the product to set properly. It needs to set at 90 degrees or above. Now that we understand the properties of SKaffold, let's learn how each version is used. SKaffold Flow is an injectable paste, again, that comes in 3, 5, and 10 cc sizes. Each kit contains the following, all in sterile packaging. The first is the powder and liquid set. There will be a perforated tear to help in removal of these materials. One side houses the powder, the other side houses the liquid. The next package contains a mixing chamber, a plunger, and a 10 cc syringe. And lastly, a package will contain one 11-gauge delivery cannula. Now that you have all the materials on the sterile field, you can begin the mixing process. It is critical to make sure the surgeon is ready to use the product, because once you start mixing, the time begins and there is no turning back. It is critical at this point to ensure that the bottom or base of the mixer is above the side port. If it is not, the liquid will pour right out and you will have to get a new kit. The first step in the process is to remove the liquid vial. Empty the contents of the liquid vial fully into the mixing chamber. Gently tap the side of the vial with the syringe to ensure all contents have been removed. In the next step, remove the cap from the powder vial. Now gently tap all the contents into the mixing chamber. Now begin a 1-minute timer. The product should be mixed vigorously for 1 minute or 100 rotations. At this point, the product is thoroughly mixed. Now you will have up to 5 minutes to load the syringe and get ready for implantation. Now that mixing is complete, unscrew the top of the mixer and scrape the SKaffold Flow from the mixing paddle back into the mixer. Rotate the base of the mixer all the way down in a clockwise fashion. The port is now half exposed, as you see here. Now insert the plunger into the mixing chamber at a slight angle. Push until it stops. Then rotate the plunger down until SKaffold Flow starts to extrude slightly out of the syringe port. Remember to remove the syringe cap before affixing the syringe on the port. Then continue rotating plunger until syringe is filled. A tip, it is best to do this quickly. It will help ensure more material is pushed into the syringe. Remove syringe from port and reattach cap. Remove the trocar from the cannula. Attach the cannula to the luer connection of the syringe cap. Now the surgeon will implant and manipulate the material. They will have up to 2 minutes to do this. Regardless of how much time it has taken to transfer the material, just prior to implantation, start a new timer. It is important during implantation that the surgeon fills in a retrograde fashion. Now the product is ready for implantation. The surgeon will have up to 2 minutes to inject, implant, and manipulate the product within the void site. Once this 2 minutes is done, the surgeon should stop manipulation. The product is hardening, and any further manipulation may fail the case. Remember, SKaffold is crystallizing. If you break the crystal formations, you will compromise the long-term mechanical structure of the product. It is important at this time to get the material over 90 degrees. To do so reproducibly, always have heated saline on the table at this moment. Dip a lap or Raytec in this warm saline and cover the void site. Bathe the implantation site every 30 seconds gently to ensure that the material is setting at or above 90 degrees Fahrenheit. Once your new timer reads at 6 minutes, the product has set. Set means the product will not move from where it is and can be irrigated and the surgeon can close. Should drilling be necessary, an additional wait time of 4 minutes or 10 total minutes must occur for drilling to begin, so please be patient should drilling be necessary. Now that 10 minutes has passed, it is okay to drill the material. Remember, when drilling, you must use a threaded or fluted drill bit. Do not drill scaffold with K-wires. Also, do not force the drill into scaffold. Let the drill do the work. At this time, it is also okay to insert screws, but do not fully tighten. Please wait a total of 15 minutes before two-finger tightening. Hopefully by now, your construct is complete and your case has been successful. The next delivery option for scaffold is SKaffold Impress. Again, this comes as a moldable putty in sizes of 5, 10, and 25 cc's. Each kit contains all sterile packed materials. Each of these kits contains a pre-measured powder and liquid vial set, a mixing bowl and pestle, and a plastic curved spatula for removal of the material. Now that all your sterile contents are on the surgical field, it is okay to begin mixing scaffold. Once again, ensure the surgeon is ready to use the product. Once the contents are put together, the clock begins and there is no turning back. At this time, take the powder vial, remove the cap, and empty all the contents into the bowl. Please tap with the pestle to ensure all contents have been removed. Step 2. Remove the cap from the liquid vial and pour those contents into the bowl. Again, tap with the pestle to ensure all the liquid has been removed. Now, set timer for 1 minute and begin mixing. Mix using the entire mixing bowl, and mix vigorously using a shearing force as shown in this video. This will help to ensure the product is thoroughly mixed and ready for implantation. You will have up to 2 minutes now to transfer the material for implantation. Take the curved end of the spatula and, scraping the side of the bowl, remove and collect the material onto the spatula. This should go very quickly. Once all the material is collected on the spatula, the material is now ready for implantation. Start a new timer. The surgeon will have up to 1 minute to implant and manipulate the material in vivo. Once manipulation and implantation are complete, it is critical to get the material at or above 90 degrees Fahrenheit. To ensure this, dip a Raytec or lap into warm saline and cover the implantation site. Over the next few minutes until the material is set, it is helpful to bathe the material every 30 to 60 seconds to ensure proper setting. Once a total time of 4 minutes has accrued, the material is set. At this point, the surgeon may irrigate and close, or if drilling is necessary, an additional wait time must occur. If you'll be drilling, wait an additional 2 minutes or a total of 6 minutes post-implantation. When drilling scaffold, ensure your equipment is fluted or threaded. Do not use K-wires. Do not force the drill into SKaffold Impress. Let the drill do the work. At this point, it is also okay to insert screws, but not fully tighten. A total accrued time of 10 minutes with Impress must pass for two-finger tightening to occur. Now we'll go over some salvaging techniques for scaffold cases. As mentioned, it is time and temperature sensitive. Therefore, some of these tricks of the trade can help aid you in your cases to get out of trouble. Should you have erred on the side of being too cold before your case, you may need to warm the product. If you're using putty during manipulation, the surgeon can simply hold the product in his or her hand to warm the product up, checking the viscosity of it every 15 to 20 seconds. Once a desirable viscosity has been achieved, implant the material. Similarly, should this occur with the flow or the injectable product, please have the surgeon wait 30 to 60 seconds until a desirable viscosity has been achieved. In this video sequence, we'll see using scaffold flow in an environment that is too hot for the product. At this point, if you see the surgeon struggling to push the material through, it may either be too hot or have a clogged cannula. In the case where it's too hot, at this point the product will not work. It will only work as a putty and probably not as an injectable. Therefore, chill another kit thoroughly and quickly and introduce a new kit onto the sterile field and mix again. Another potential inoperative issue could be a clogged cannula, sometimes with a bone plug or sometimes with a plug of the material. If you see a potential problem where the cannula may be clogged with a bone plug or a plug of scaffold, simply have the surgeon remove the cannula from the syringe. Then take the trocar, insert it fully into the cannula, removing any clogs. These usually consist of bone or hardened material. At this point, reinsert the cannula and begin implantation of the product once again. To salvage a hot impress case, should you notice that during the collection process of an impress case that the material appears dry or crumbly, simply have the tech or surgeon dip their hands into saline and start handling the product once again. This will bring the product back to a viscosity level that's usable. Furthermore, during implantation, should the same thing occur, repeat the process by dipping his or her gloved hands into saline and then manipulate the product. As has been mentioned earlier in this video, SKaffold has a second indication which is unique to it amongst all other alpha TCPs and calcium sulfate grafts. It can be used as an autograft extender. This means it can be used with autograft as a bone graft extender. In example, extremities and pelvis only, meaning not in the spine. At this point, this graft becomes a combination graft. It combines both the properties of autograft with that of a mineral or ceramic-based bone graft substitute. So let's look at each of the properties of those classes. Autograft bone is the gold standard. Harvesting of the patient's own bone often requires a second surgical site. In this case, it'll be morselized autograft. Its advantages are it possesses all three biologic bone-forming qualities. The disadvantages are there is potential for increased morbidity and infection. There involves more pain sometimes. There is limited quantities and limited mechanical strength. As we look at its algorithm, again, biologically, it holds all three properties. Structurally, once morselized, it holds very little structural component, maybe 1, 2, or 3 megapascals of strength. Chemically speaking, it is bone, so it is certainly like bone. And the handling characteristics of it at this point would be granules and morsels, but again, it can also come in blocks and wedges. And the remodeling time by itself would be 3 to 6 months. As a reminder, SKaffold is an alpha tricalcium phosphate, which again converts into hydroxyapatite, which is similar to the mineral phase of bone. The advantages are it's similar to native bone. SKaffold has strength greater than native bone. It is drillable. It remodels naturally. It's excellent for augmentation of hardware. It has no strength deficit during healing, provides immediate and long-term mechanical strength, and is osteoconductive used alone. Again, it is finicky to use sometimes because of its temperature and time sensitivity. It needs to be mixed always, and it remodels at a slow rate of speed. As a reminder of the algorithmic properties of SKaffold, it's osteoconductive, high strength at 50 or more megapascals. It's like bone, and it comes in injectable and putty formats, and remodels by itself in 3 to 10 years. Now you have a truly unique product when you combine the algorithmic properties of both morselized autograft and SKaffold impress. When mixed, it creates an osteoconductive, osteoinductive, and osteogenic graft. The inductiveness and osteogenic properties coming alone from only autograft. Structurally, it's similar to bone strength, between 5 and maybe 25 megapascals. Of course, both products are like bone, so this resulting product is like bone. It can only be used in putty format at this point because of the morselized autograft, and the remodeling time ends up being between 6 months to 2 years. This combination product has the following other properties that are important to know. Again, both are isothermic, so the resulting product is isothermic. The porosity is at 40% nanoporosity with macropores created through the addition of the autograft. So you have both a nanoporous and macroporous product. SKaffold plus autograft is a hard-setting product and cures in about 24 to 72 hours. And still, it is not adhesive because neither graft is adhesive alone, so therefore together they are not adhesive. Again, when utilizing this indication, you will use SKaffold impress, which comes in a putty formulation, and you will harvest morselized autograft bone, as seen in the picture to the right. There are a couple recommended ratios for adding autograft to SKaffold. The easiest and most reproducible one is to mix a ratio of 1 part to 1 part, meaning 10 cc's of SKaffold to 10 cc's of autograft, or any unit measure that is supplied. Now we'll explain the process for adding autograft to SKaffold impress. Note, it is important to collect morselized autograph before starting this process. You will mix the product for 1 minute. At this time, take the powder vial, remove the cap, and empty all the contents into the bowl. Please tap with the pestle to ensure all contents have been removed. Step 2. Remove the cap from the liquid vial and pour those contents into the bowl. Again, tap with the pestle to ensure all the liquid has been removed. Now, set timer for 1 minute and begin mixing. Mix using the entire mixing bowl, and mix vigorously using a shearing force as shown in this video. This will help to ensure the product is thoroughly mixed and ready for implantation. Now that SKaffold Impress has been mixed, you will add the autograft. Then incorporate using the same mixing motion for an additional minute until you have one homogeneous mix. Once a total of 2 minutes has elapsed now, you will use the curved end of the supplied spatula to collect all the material. At this point, you will have up to 2 minutes to implant into the body. Once implantation begins, begin a new timer. The surgeon will have 1 minute to implant and manipulate the material. Once 1 minute has elapsed, the surgeon should stop. At this time, it is important to get the material at or above 90 degrees Fahrenheit. To do this, using heated saline, dip a lap or a Raytec into the warm saline and cover the implantation site. It is helpful to bathe the covered material every 20 to 30 seconds to ensure proper setting at a temperature at or above 90 degrees Fahrenheit. An additional waiting time of 10 minutes or a total elapsed time of 11 minutes is required so that the material is set. At this time, it is okay to irrigate and close. Where is SKaffold best used? Typical cases where SKaffold is best utilized include trauma and fracture cases, typically in the metaphyseal areas of bone, total joint revisions, autograft backfilling, tumor and cyst voids, and fusion cases, only when used as an autograft extender with bone autograft. Which docs use SKaffold the most? Those would include orthopedic trauma doctors utilizing it in fractures of the tibial plateau, proximal humerus, acetabulum, calcaneus, distal radius, to name a few. Oncologists utilizing SKaffold in tumor, cyst, and osteolytic voids. Hand and upper extremity surgeons can utilize SKaffold in distal radius cases and chondromas, proximal humeruses. Foot and ankle surgeons have many uses for SKaffold, including the calcaneus, wedge osteotomies, Liz Frank fractures when utilized with autograft, and cysts. And joint doctors use it for acetabular cup revisions, tibias, and glenoid voids. In the following sequences, you'll see X-ray evidence of the ways that SKaffold can be used usefully in orthopedic procedures, and many different types. Some of these cases include tibial plateau fractures, calcaneal fractures, femoral fractures, distal radius osteotomies and fractures, revision cases like total knees, tumor and cyst voids anywhere in the body, as seen in this calcaneal cyst and this giant cell tumor of the tibial plateau. As you can see from the information provided in this video, SKaffold is a very unique product that presents the surgeon a wonderful tool for reaching clinical goals to get patients back on their feet as soon as possible. With superior strength in its class, multiple delivery options, many different sizes, and a strength profile above and beyond that of all of its competition, you have a wonderful tool to present to your surgeons, that and an additional indication. We hope this video has provided you with a baseline education for selling SKaffold successfully and improving patients' lives.